Hello friends, if you are in a Medicare Advantage plan and you just received a denial letter, do not put that letter in a drawer and assume the plan's answer is final. That one letter may have a clock running on it. If the plan refused to cover a service, a supply, an item, a Part B drug, or a payment you believe should be covered, the next step may be an appeal. In Medicare Advantage, that first appeal has a specific name, a specific path, and a deadline many people miss. A Medicare Advantage denial is not always the end of the road, but it can become harder to fight if you wait too long, lose the notice, call the wrong number, or never ask the doctor for the right supporting statement. This video is especially important if you are on Medicare Advantage. If you help a parent with Medicare paperwork, or if you got a letter saying the plan will not authorize, cover, continue, or pay for something your doctor says you need. Before we get into the steps, if you're not subscribed yet, subscribe and turn on the bell. Medicare letters, Social Security notices, plan denials, appeal deadlines, and senior money rules can be confusing, and many people are never personally walked through them in plain English. I break these issues down so you can check the letter before the deadline passes. Now let's translate this denial letter into plain English. The first thing to understand is the phrase Medicare Advantage uses for a coverage decision. In a Medicare Advantage plan, a coverage decision is called an organization determination. That sounds complicated, but the simple meaning is this. Your plan is making an official decision about whether it will authorize or pay for a healthcare item, service, supply, or certain drug, how much you must pay, or whether there is a limit on what you can receive. That is why the letter matters. It may be the formal notice that starts the timeline. Here is mistake number 1. Thinking a complaint and an appeal are the same thing. They are not the same. A complaint, sometimes called a grievance, is usually about the quality of care, customer service, how you were treated, delays, difficulty reaching the plan, or problems with the service experience. An appeal is different. An appeal is what you use when you disagree with a coverage or payment decision. If the plan refuses to cover a service, supply, item, or drug you think should be covered, that is appeal territory. If the plan refuses to pay for something you already got, that may be appeal territory. If the plan changes the amount you must pay, or stops paying for something you believe you still need, that may also be appeal territory. So when you call the plan, do not just say, "I want to complain." Say this instead, "I received a denial notice. I want to understand my appeal rights, and I want to know how to request a reconsideration." That word matters. In a Medicare Advantage plan, the first level of appeal is called a health plan reconsideration. Now here is the deadline many people miss. For a Medicare Advantage reconsideration, the request generally must be filed with the health plan within 65 calendar days from the date on the organization determination notice, which is the denial notice. Notice what I said, from the date on the notice. Not from the day you finally opened the envelope, not from the day your adult child read it, and not from the day you finally got through on the phone. So here is your first action step. Take the denial letter and circle 3 things: the date of the notice, the item or service being denied, and the appeal instructions. Then write the 65-day deadline on a calendar. If you are helping a parent, take a photo for your own records, but do not share private Medicare numbers or personal information by text or in public comments. If the letter tells you how to send the appeal by mail, fax, portal, or phone, follow the plan's instructions. The notice is not decoration. It is your roadmap. Here is mistake number 2. Waiting for the doctor's office to handle everything without checking. Your doctor can be very important in a Medicare Advantage appeal, especially if the denial is about medical necessity, prior authorization, a service you have not received yet, a referral, a supply, or a treatment plan. But do not assume the doctor's office automatically filed the appeal just because someone said, "We will look into it." Ask directly, did you file a reconsideration with the plan, or did you only send more records? Those are not always the same thing. If the appeal is for a service you have not gotten yet, your doctor may be able to ask for a reconsideration on your behalf. And if the issue is urgent, a doctor's statement can be especially important. So here is the exact question to ask your doctor's office. Can the doctor provide a written statement explaining why this service, item, supply, or treatment is medically necessary under my condition? You are not asking the doctor to guarantee a win. You are asking for support that makes the appeal stronger. The medical reason, why the plan's alternative may not work, what happens if the service is delayed, and whether this is urgent. Here is mistake number 3. Not knowing the difference between a standard appeal and an expedited appeal, a standard reconsideration is the normal path. For many pre-service appeals, the plan has up to 30 days to decide. For payment appeals, the standard timeline can be longer. For certain Part B drug appeals, the timeline can be shorter. But if waiting for the standard timeline could seriously harm your health, your life, or your ability to regain maximum function, you may ask for a fast appeal, also called an expedited appeal. Not every appeal qualifies, but if the health risk is real, ask. Use this sentence: I am requesting an expedited reconsideration because waiting for the standard time frame could seriously harm my health. Then ask your doctor to support that urgency if the doctor agrees. If a physician requests an expedited reconsideration, plans are required to treat it as expedited. If the plan agrees that the case is urgent, the decision timeline can be much faster. Do not use expedited just because you are frustrated. Use it when the health risk is real. Here is mistake number 4. Calling the wrong number or trusting a random number online. Use the phone number on your Medicare Advantage plan membership card or the number printed on the denial notice. Do not call a number from a random comment, a social media post, a sponsored ad, or a stranger who says they can fix your Medicare denial. When you call, write down the date, time, representative's name if available, reference number if they provide one, and exactly what they told you. Ask these questions first. Is this denial an organization determination? Second, how do I request a Level 1 reconsideration? Third, can I submit this appeal verbally or does my plan require it in writing? Fourth, where do I send medical records, doctor statements, and other supporting documents? Fifth, how do I get proof that the plan received my appeal? Some standard requests must be made in writing unless the plan accepts verbal requests. Expedited requests can often be made verbally or in writing, but do not guess. Ask your plan and check your evidence of coverage. Here is mistake number 5. Sending the appeal with no proof and no copy. If you mail something, keep a copy. If you fax something, keep the fax confirmation page. If you upload through a portal, save or print the confirmation. If you call and submit verbally, ask for a confirmation number or written acknowledgement if available. Do not send your only copy of the denial letter. Keep the original or keep a clean copy in a folder. A simple appeal packet may include your name, contact information, Medicare number if required by the plan, the service or item being appealed, the date of service if it already happened, the reason you disagree, the denial letter, supporting records, and a doctor's statement if available. If someone else is acting for you, the plan may need representative paperwork. A trusted family member can help you organize, but the plan may not be allowed to discuss private information unless authorization is handled correctly. Here is mistake number 6. Arguing emotionally but not answering the denial reason. A denial letter can feel cold. It may affect pain, mobility, independence, bills, and peace of mind. But the appeal should respond to the reason the plan gave. If the plan says the service is not medically necessary, your support should explain why it is medically necessary. If the plan says the provider is out of network, ask about network rules, referrals, prior authorization, emergency rules, or any plan-directed care issue that may apply. If the plan says a less expensive alternative must be tried first, your doctor may need to explain why that alternative is not appropriate for you. If the plan says documentation is missing, ask exactly what documentation is missing and how to submit it. The strongest appeal is usually not a long, angry letter. It is a clear response to the denial reason, backed by the doctor, the records, and the plan's own instructions. Here is mistake number 7, mixing up original Medicare, Medicare Advantage, and Part D drug appeals. This video is about Medicare Advantage health plan denials. If you are in original Medicare, the first appeal process uses different words and different paperwork. Original Medicare has Medicare summary notices and redeterminations through the Medicare administrative contractor. If the denial is only about a Part D prescription drug plan, that process has its own terms and timelines. And if you are in PACE or a special plan type, your appeal rights may be different and the organization should give you written information. So do not use the wrong form just because it says Medicare appeal somewhere online. The right appeal path depends on what kind of coverage made the decision. Ask this exact question. Is this appeal under my Medicare Advantage medical benefits, my Part D drug benefits, original Medicare, or another plan process? That one question can prevent wasted days. Here is mistake number 8. Assuming a denial means you must pay immediately. Do not ignore a bill, and do not refuse to pay something without checking. But do not panic pay a large bill before you understand whether you have appeal rights, whether the provider billed correctly, whether the plan needs more records, or whether the denial can be reconsidered. If you already received the service and the plan denied payment, ask the provider's billing office. Has this claim been reviewed with the plan, and do you have all the denial and appeal information? Ask the plan, if I appeal this payment denial, what happens to my billing responsibility while the appeal is pending? And if the bill is large or confusing, ask for an itemized bill and keep every notice. Here is mistake number 9, missing what happens after level 1. If the plan reviews the denial and still decides against you, fully or partially, Medicare Advantage appeals can move to the next level. In many cases, if the plan upholds its denial at level 1, it sends the case to an independent review entity for level 2 review. So if you receive a second decision letter, do not throw it away. Read it for the next deadline and next instruction. Medicare appeals can have multiple levels, and each level has its own decision letter and instructions. This does not guarantee success. But it means you should not assume the first no is automatically the final word. Now let's put this into a simple 7-step checklist. Step 1. Keep the denial notice. Do not throw away the envelope, the pages, or the plan instructions. Step 2. Circle the notice date and count the deadline. For a Medicare Advantage health plan reconsideration, the deadline is generally 65 calendar days from the date of the organization determination notice. Step 3. Identify what was denied. Was it authorization before care, payment after care, a Part B drug, a supply, an item, a provider service, or continued coverage? Step 4. Call the plan using the number on your plan card or denial notice. Ask how to request a Level 1 reconsideration and whether the plan requires writing. Step 5. Ask the doctor for support if medical necessity is involved. Ask for a statement that responds directly to the denial reason. Step 6. Request expedited review if waiting could seriously harm your health, and ask the doctor to support the urgent request if appropriate. Step 7. Keep proof. Keep copies, fax confirmations, portal confirmations, mailing receipts, call notes, representative names, and decision letters. Here is a short script you can use when calling the plan. I received a denial notice dated blank. I am calling about the denied service or item listed in the letter. I want to understand my right to request a Level 1 health plan reconsideration. Please tell me the deadline, how to submit it, what documents are needed, and how I can get proof that my appeal was received. If you need help, you can also contact your local state health insurance assistance program, often called SHIP. SHIP counselors provide free local Medicare counseling. They are not there to guarantee an appeal result, but they may help you understand your rights, plan documents, and next steps. If the denial involves a serious health risk, complicated records, a large bill, or a dispute you do not understand, consider asking for help from the doctor's office, a trusted representative, SHIP, or a qualified professional. Before we close, I want to answer 3 common questions. Question 1. Can my doctor appeal for me? In some Medicare Advantage situations, especially when the service has not been received yet, your doctor or healthcare provider may be able to ask for the reconsideration on your behalf. For certain higher appeal levels or representative roles, paperwork may be needed, so ask the plan exactly what is required. Question 2. Is this an appeal or a complaint? If the issue is a refusal to cover, pay, authorize, continue, or change what you owe for a service, supply, item, or drug, think appeal. If the issue is poor treatment, customer service delay, or quality of care, think complaint or grievance. Sometimes people have both, but you do not want to file only a complaint when what you really need is an appeal. Question 3. How many days do I have? For a Medicare Advantage Level 1 reconsideration, the key number to remember is generally 65 calendar days from the date on the initial denial notice. But always follow your specific notice and plan materials, because your letter is the document that tells you how to proceed. So here is the full picture. A Medicare Advantage denial letter can feel final, but it may actually be the start of the appeal clock. The coverage decision is called an organization determination. The first appeal is called a health plan reconsideration. The deadline is generally 65 calendar days from the date on the notice. Your doctor may be able to help support the appeal. A fast appeal may be available when waiting could seriously harm your health. And proof matters. Copies, confirmations, dates, names, and written records. Do not panic. Do not ignore the letter. Do not trust a random phone number. Do not assume the doctor filed everything unless you confirm it. And do not post your Medicare number, claim details, or private medical information in the comments. If you want to comment, use something safe. You can write appeal if you received a denial letter and you are trying to understand the process, or complaint if your issue is more about service or treatment. But do not post your personal details. Subscribe and share this with someone on Medicare Advantage or with an adult child helping a parent with Medicare paperwork. One letter, one deadline, and one missed appeal step can make a real difference.